Hi, and welcome to our series, Mental Health The Struggle is Real, reaffirming our strengths in the Black community, in partnership with BlackDoctor.org and supported by the Substance Abuse and Mental Health Services Administration. My name is Tamika Welsh, and I am your presenter for today. I will be presenting on the topic Culturally Responsive Mental Health Care for BIPOC Communities. Before I begin, I'd like to thank BlackDoctor.org for allowing us to use your audience and followership as well to spread the knowledge on the importance of BIPOC mental health. I also want to thank Howard University School of Social Work and Substance Abuse and Mental Health Services Administration for this collaboration. Before we begin, I would like to take a minute to introduce myself. My name is Tamika Welsh, and I'm an adjunct professor at Howard University School of Social Work. I received my master's from Columbia University and my bachelor's of social work from North Carolina A&T. For my professional experience, I have over 7 years of experience working firsthand with individuals with various mental health issues related in schools, hospitals, and nonprofit settings. That's a little bit about me. However, today we're going to discuss the importance of BIPOC mental health. I'm going to talk a little bit about how to spread awareness, support individuals who identify as BIPOC, and what you may need to know in regards to additional resources or guidance. I'm also going to share a few statistics on mental health pertaining to individuals in the BIPOC community. And I just want to make sure everyone knows that I would like to create some engagement. So feel free to write something in the chat, whether it's something related to the statistics or something you would like to share personally. Thank you. To keep me on course today, I have wrote the objectives for today. So I'm going to raise awareness. I want everyone to educate themselves about the unique mental health challenges that are faced in the BIPOC community. I'm going to highlight the resilience and strengths that these individuals showcase in their personal lives and communities. I'm going to promote cultural competence, providing strategies and tools for mental health professionals and allies to enhance cultural competence when working with BIPOC individuals. I'm also going to empower and inspire. I want individuals joining to feel like they understand what the individuals in the BIPOC community go through by affirming their strengths and promoting self care practices that align with cultural values and community support. I know all of you who are tuning in may not identify as an individual in the BIPOC community. However, I would like for you all to take away something, whether you're a social worker or a clinician or ally, there's going to be something for you to take away today. So, mental health is important, and I would like to highlight BB Moore Campbell. BB Moore Campbell is the founder of BIPOC Mental Health Awareness Day. She has struggled support with her daughter and battling her own personal mental health illnesses, and she decided to create a system that will help prevent her family from or anyone else from getting support. She founded Near Me Inglewood in a predominantly Black neighborhood to create a space that was safe for Black people to talk about their own personal mental health issues. Throughout her time as an advocate, Campbell made her way to Washington, D.C. on June 2nd, 2008, and Congress formally recognized her day as National Minority Mental Health Awareness Day. She then transitioned to bring awareness to unique struggles that underrepresented groups face in regards to mental illnesses in the United States. And that is how we have BIPOC Mental Health Awareness Month. So I want to ask a question to you all today. Did you know that 28% of people who are BIPOC experience anxiety? Did you also know that 24% of individuals who are BIPOC experience depression? So, BIPOC individuals experience mental health issues due to a complex interplay of historical, social, and systemic factors. These communities often face higher levels of discrimination, socioeconomic disparities, which contribute to a high alarm of stress, anxiety, depression, and trauma. Historical trauma, such as colonization and slavery and displacement, has generation impact on mental well-being. Additionally, inadequate access to culturally competent mental health services and the stigma within both communities and broader society have faced challenges. Addressing BIPOC mental health requires a comprehensive efforts to dismantle systems and provide equal access to healthcare and promote culturally sensitive support systems. Have any of you related to these statistics? If so, how did you combat your mental health issues? The Anxiety and Depression Association of America reported that in 2020, Black and Latina youth were 14% less likely than white youth to receive treatment for their depression. I believe it's crucial for the younger generation to advocate for mental health due to a couple of reasons. First and foremost, mental health issues among young people are prevalent and can impact their well being, whether it's academic performance or personal self esteem or just overall for their advancement in their future. By younger individuals advocating for mental health awareness and support, young people can reduce stigma surrounding mental illness, creating a more open, supportive environment. We know that the older generation feels that mental health is taboo. So if we have the younger generation, such as millennials or Gen Z, we can combat that stigma. And we can also encourage the youth to advocate for different policies and issues in place to support them. Ultimately, empowering the younger generation to advocate for mental health fosters a more compassionate and inclusive society that values and supports the well being of all. Statistics like this are a primary example of why we need to educate and stir the conversation regarding mental health. Because if in the older generation doesn't believe in mental health, they may find it, we don't really need to talk about that. And the younger generation may need a safe space and outlet to have these conversations. So what I've noticed is that BIPOC, Gen Z, millennials, they're continuously working to break the stigma, whether that's talking to their parents, their friends, using social media like TikTok or Instagram to make videos, to encourage one another. So, BIPOC communities have historically faced discrimination, as we all know. However, what we do know is that within the communities, that trauma can live on for further generations. So, by breaking the stigma and creating dialogue within adults as well as children, we can culturally create an ongoing community support for these individuals. So I want to ask the chat, how do you plan to address the mental health challenges faced by BIPOC individuals? I'll give you all a second to write your responses in the chat. According to Mental Health America, around 17% of Black people and 23% of Native Americans live with a mental illness. And people who identify as belonging to two or more races are most likely to report any mental illnesses within the past year than any other racial or ethnic group. So, what does that mean? They're less likely to have access to mental health services, less likely to seek treatment, more likely to receive low or poor quality care, and more likely to end services early. Statistics tell us that about 25% of African Americans seek mental health treatment compared to 40% of white Americans. So while we are seeing a trend of Black people reaching out for therapy or any type of mental health services, we don't see that the numbers are equal, which means that we have to keep having these conversations, advocating for our communities, and just being open and understanding regarding mental health. Unequal access to healthcare is one major contributor to this disparity. So we do know poverty plays a part. So if individuals are not having access to insurance or they don't know the resources that are out there for them, they're unlikely to receive treatment because they're not sure of what is available to them. Nearly 10% of Black people in the United States do not have health insurance compared to 5.2% of non Hispanic white people. So, why is cultural consideration important? This understanding leads to more accurate diagnosis and development tailored treatment plans that resonate with patients' cultural belief, increasing treatment adherence and effectiveness. We want to be culturally competent because want our clients and patients to know that we're promoting accurate understanding and engaging with them from a diverse background. In addition, it also fosters trust, mutual respect, and open communication between the provider and the patient. We're creating a safe space and individuals for seek help. With cultural competence, there may be communication, understandings, and correct diagnosis. And if we don't have cultural competence, we'll find misdiagnosis or misunderstandings and lack of communication, leading to poor treatment outcomes. It's essential for mental health professionals who are culturally competent and they can conduct more sensitive and relevant assessments and figure out what is more appropriate after they've assessed the patient. Some of you all joining today may be social workers, licensed social workers, clinicians, or therapists. I have 5 tips that I believe that would be beneficial for you all if you're interested in supporting your clients who identify as BIPOC. The first one, cultural competence. You want to educate yourself on the cultural backgrounds, histories, and experiences of BIPOC communities to better understand their unique perspectives on mental health. Why? Because you have a better understanding with connecting with your client when you will fully know their cultural background. Everyone isn't the same. So when you fully understand where your client is coming from, their background and history, you can provide an accurate assessment on how to support them and what they may need at the time. We also want to understand that just because everyone in your practice or you're supporting identifies as one race doesn't mean they all have the same background and upbringing. So, fully understanding your client and their needs will best assist you and your client as well. Number 2, trauma informed care. You want to recognize and address the potential impact of systemic racism, discrimination, and intergenerational trauma on their mental health. What happened before they had a seat in your office? You want to recognize anything that has happened before because that can play a part in how they are reacting in today's world, whether it was PTSD or from their upbringing. Do a thorough assessment to figure out what it is that your client is coming to you to seek support for and work through those traumas and figure out how can you support them in that present moment. Empowerment and advocacy. Number 3, encourage empowerment through advocacy, helping BIPOC individuals navigate and challenge barriers to mental health care access and support. You want to encourage your patients or clients to advocate for themselves so that way they can see changes within their mental health, whether it's to their community or in a neighborhood or just a part of an organization that they are a part of, so that way the individuals at the service can have support and access to all the resources that they need. Number 4, culturally responsive therapy. You want to tailor your therapeutic approaches to be culturally responsive, respectful, and integrating the cultural values, beliefs, and practices of BIPOC clients into treatment plans. So whether your client is seeking therapy for trauma or for just understanding, current issues, you want to tailor your therapeutic approach so that way it's appropriate. You want to make sure that your client is getting the right therapeutic model that they need versus a different one, and it doesn't really help them. Number five, you want to address social detriments of health. You want to acknowledge and discuss how social detriments, such as socioeconomic status or lack of access to resources, intersect with mental health issues for BIPOC individuals and work collaboratively to address these factors in therapy. Some of your clients may not have the funds to live their day-to-day life, such as pay rent, afford groceries, go to the doctor, or even take care of like oral care. A lot of those detriments can impact one's mental health because they can feel um, less than or undeserving because they're not able to meet their day to day needs. Take a moment to work through with your client to figure out what it is that they're lacking or what they need help with, and then work through their trauma and see how this has impacted their mental health. By utilizing these tips, you'll be able to emphasize the importance and understanding of cultural competence and providing trauma informed care by supporting your clients through therapy. For those of you who are allies, I want you all to take some time today to educate yourself about mental health. What is mental health and what does it really mean? I know we hear the buzzword going around social media, but I want you all to encourage yourself to take some time to learn about the topic and also learn about some challenges faced by BIPOC individuals, which includes systemic racism and historical trauma. I want you all to listen actively. What does that mean? Practice active listening when BIPOC individuals share their personal experiences and feelings and emotions and avoid judgment. If you're an ally, you may not be able to resonate with what an individual is saying about their personal experience, but this is a time for you to just sit back, listen, and to ask questions. What does that mean? How does this impact you? And you'll be able to have a different perspective. Three, offer support. Offer your support in practical ways, such as accompanying them to therapy appointments or helping them find culturally competent mental health resources or just listening. Sometimes it's just okay to listen and offer support. You may not be able to do something in the moment, but little do you know, listening offers way more advantage than just something monetary. Number four, respect cultural differences. Respect and honor cultural differences. Be mindful of the differences between yourself and the person that you're speaking with, and how cultural differences play an influence in perceptions of mental health and seeking behaviors. As I mentioned before, we all come from different backgrounds. So it's important to honor and respect someone else who doesn't have the same upbringing or background as you, so that way you can fully understand what they're going through and what they may need in a moment. And last but not least, be an ally. Speak up against any racism or discrimination in all forms. Support initiatives and organizations that promote mental health awareness and access for BIPOC communities. Advocate for inclusive and equitable mental health care policies and practices. Whether you're in the workplace or you're speaking to a friend or you're just in your community, be sure that you're able to speak up against racism or any discrimination so that way you're the person that you're supporting feels supported, but also you're making a huge change, not only for that person, that community, but for the greater good. These tips will help you all emphasize the importance of education, active listening, practical support, and effectively support BIPOC individuals with mental health issues. Celebrating diversity. So, celebrating BIPOC individuals is important. We want to recognize and honor and embrace the richness of all cultures and histories and experiences contributions of BIPOC communities. Here are several ways you can do that. Again, promote cultural awareness. Educate yourself and others on the diverse cultures that the BIPOC community has. So, whether that's with languages, histories, or traditions, immerse yourself into that culture by attending cultural events. Read literature books. There's so many books out there on various um, diversity topics and communities that you're able to fully learn and grasp what that community may or may not have been through or what they're currently going through. And there's also literature books by BIPOC authors, or you can also explore different cuisines. What does that cuisine mean to that culture? Why was that created? Everything has a history to it. Two, support BIPOC artists and creators. You want to amplify the voices and talents of BIPOC artists, such as musicians, writers, filmmakers, and creators. You can attend their performers. Look in your local area, whether you're in DC, Maryland, Virginia. Look up what's going on this summer. Who are some filmmakers or creators that I can support and look into who are of the BIPOC community? You want to attend their performances, buy their artwork, and share their work with others because that is how you amplify the voices. Number three, celebrate Heritage Months. Participate and support celebrations of Heritage Months dedicated to different BIPOC communities, such as Black History Month. Juneteenth is also something you can look into. Native American Heritage Month, Asian American Pacific Islander Heritage Month. Look into those dates and really learn the history of all of those heritage months and learn about the cultures and histories. Number four, acknowledge contributions. Highlight and celebrate the historical and contemporary contributions of BIPOC individuals in various fields, including science, tech, business, politics, sports. Highlight and figure out what is something that I can do to really focus on what these individuals contributed to our society. Engage in intercultural exchanges. So foster connections and build relations with people from different racial and cultural backgrounds, whether it's at work, your neighborhood, or at your local gym. Take a moment to immerse yourself in someone else's culture. Hey, start off a conversation or, ask them anything that you think will deem respectful. If you would like to have a conversation and exchange stories, learn about each other's perspectives. That is how you learn, and you're able to build community, and you're able to learn about who they are, what they've been through, and how you can support. Support diversity in education and workplace. Advocate for inclusive curriculum and policies that reflect the diversity of BIPOC communities in schools, colleges, workplaces, and at work. Stand against racism and discrimination. Take action against racism, discrimination, and social injustice that have disproportionately impacted the BIPOC community. When using these tips, you're able to celebrate BIPOC individuals and for ongoing commitment, respect, and appreciation for their identities and experiences within these communities. It's all about fostering an inclusive society where all individuals are valued and their contributions are recognized and celebrated. What are you going to do today to celebrate diversity? You can write your responses in the chat. Here are some reflection questions. I want you all to take a moment to think about these questions. Will ideas I put forward that advocate from my perspective as a person of color be supported? Will my friends and family members reject the thoughts and feelings that reflect my experience? Will my presence create assumptions that carry over into my coworkers' interaction with the next person of color they interact with? I'll give you guys about a minute or two to think about these reflection questions. As you're thinking about your responses, I want you all to think about how you would share your advocacy and your voice with your community today. Now, I will share a YouTube video of highlighting the importance of BIPOC Mental Health Awareness Month.
Yeah, dude, she's crazy.
I don't know about that. That's kind of stigmatizing to say.
Huh? What's a stigma?
I heard the word stigma, but also never knew what it was until recently. Mental health in my family was never talked about much because it was seen as a weakness. We were taught to never share our business with others because nobody should see or hear you struggle. You always think that if something is going on with your mind, that society is going to label you. And that's a stigma. All of this prevents us from accepting our struggles and getting help. But I think that getting help means you're strong. Like, we are all so critical of ourselves. It takes everybody time to feel like they want to open up, but you shouldn't judge yourself or your friends and family.
I mean, it's true. Anyone can have mental health challenges, no matter if you're male or female or non-binary or black, white, Latinx, or your sexuality, religious beliefs, age, or how much money you have. Anyone can struggle. Even I've struggled.
Yeah, and stigma is often what stops you from getting help. Because, you might think that you'll be treated differently or face discrimination if you admit that you're struggling. But, don't be too hard on yourself. Nobody is weak for struggling.
It's hard because I got stereotypes from my family traditions, intergenerational trauma, my religion, social media, just to name a few. It's like what you said. I feel like it turned into shame or like a self-stigma. I started to think negatively about myself for struggling with mental health when I did. After I came to terms with the fact that I wasn't doing well, that I was worried about myself, I reached out for support. And I know it's not the same for everyone, but my friends supported me. They offered to go to group sessions with me or gave me a ride and told me that it didn't change how they thought of me. I didn't expect them to react that way because we don't have these type of conversations, But I'm glad I said something. I'm still having conversations with my family. Maybe they'll come around when they know more. We can get rid of stigma by taking care of ourselves and encouraging each other to do the same.
I think mental and physical wellness are similar, but mental pain isn't always visible. If someone has the flu or a broken bone, we don't judge or blame them. We encourage them to take care of themselves. It should be the same for mental health.
100%.
But yeah, stigma is everywhere. It's on the media and on TV, but also in the language we use, like you calling that girl crazy or someone saying, "You'll get over it." That stuff can affect people negatively. It can cause bullying, and it can make someone believe that they'll never recover or that they're a worse person somehow, which is just not true. Getting help for your mental health doesn't define who you are or change your ability to be independent. It means that you're able to find solutions and healing.
You're right. I guess what I meant to say is that she doesn't seem like herself, that something is different and I am concerned.
Yeah, that sounds better. The words we use matter. They can affect if someone feels comfortable talking about their challenges. I'd say that if someone reaches out to you for support, make sure they know that you're there for them and that this doesn't change how you think of them. When people understand what mental health is, that mental health doesn't change who you are as a person, then stigmas won't have such an impact in our community. Anyways, I'm glad we had this conversation. I'm always here to talk.
I hope you all enjoyed that small but mighty video. That dialogue is something that happens common. A lot of people, don't know the appropriate terms to use, or they just they ignore their friends or family members emotions because they can't fully process it. So I wanted to share that video because I wanted you all to see it's common in the BIPOC community as well as other communities, that the stigma around the conversation is still not fully normalized. It's being normalized. We're discussing, we're having these conversations, but recognizing your words matter and being supportive to your loved ones is mostly important, especially in today's times. So taking some time out to fully recognize how you can be there for them and support them is really important. On my screen, you'll see a couple of mental health resources for the BIPOC community. And there's several ways you can bring awareness to mental health issues as we discussed today. So one of the few ways is by donating to organizations, which in return will allow the organizations to provide services to minorities in need. If you would like to donate, there are a couple organizations on the screen that you'll be able to support for BIPOC individuals who suffer from mental health issues, but also if you yourself would like a resource, these organizations provide therapy. They connect you to resources to therapy. They provide ongoing support to individuals, whether you're queer, trans, black, a black woman, or black male. Take a moment to screenshot this. You can follow them on Instagram, search their websites, and see maybe they have ongoing events in your communities or wherever you are located. Um, Via worldwide. So I'll give you guys a second. Okay. And now I will leave the evaluation on the screen. I want to thank you all for joining me today and learning a little bit about how you can support BIPOC individuals or support yourself, whether that's taking care of self care, learning more, reading more, educating yourself, and just being patient with your loved ones, your coworkers, or friends, families, anyone in your space or community. On the screen, you'll see a QR code for evaluation. Let us know, what did you learn today? Was it helpful? What would you like to see in the future? Thank you.